Hello. Hello, Vibha doctor.
Yeah, we start ചെയ്യാം. Yeah.
Audible അല്ലേ? Sound okay അല്ലേ?
അതെ.
Good evening, everyone. Welcome to Excel 2022 webinar series. Let's start by paying tribute to our master, Dr. Samuel Hahnemann. Today we have Dr. Vibha here. Dr. Vibha is a visionary and enthusiastic homeopathy. She completed BHMS from Nashik University in 2015 and did PG courses CCAH and MCAH from the Othersong International Academy of Advanced Homeopathy in 2017 and get trained under world-renowned homeopaths and running Samridhi Homeopathy Clinic at Indo since 2018 with great success. She is a classical homeopath, an international speaker, and invited on many prestigious platforms. She is author of various national and international journals of homeopathy and published a number of successful cases and articles. She is the chief editor of the Homeo Healers newsletter, Delhi, and ex-coordinator of Scientific Committee Board of All India Homeopathic Students and Youth Association, West Bengal. She organized many free national educational events during pandemic. She is running online and offline yoga classes as she is a certified yoga instructor also. She is director of Samagri Institute of Homeopathic Education and offered 3 courses on classical homeopathy, which are going to start soon. I welcome you to this webinar series, ma'am.
Thank you so much. Am I audible, Dr. Simi?
Yes, Dr. Audible.
Okay. So thank you so much, first of all, to IHMA and Dr. Deepu for inviting me for this session. So good evening, all of you. This is Dr. Vibha from Indore. So as you all know that today's topic is classical approach for PCOD and homeopathy. So I have some intention to select this topic for today's session actually. So do you know the 1 out of 5 women in India are suffering from PCOS or PCOD, which is the 20% of women population of India. And in my understanding, it's a very high level which is suffering with the same problem. So I feel it's a high time for homeopaths. As a homeopath, I feel that it's a high time for homeopaths to take in charge on their hand, because we know very well that how homeopathy can treat and can help with this problem of women. And as a female homeopath, I'm getting so many cases of PCOD, which are in very early age, like in 19, 20, 21. With this age, girls are suffering with this problem nowadays. So before going to proceed this session, first, I think we should know why this problem is there and what are the causative factors and how these things affect on women's body. So the main hormone which is responsible for the PCOD is an androgen, which is a male hormone. Normally it presents in female body, but in very less quantity. When this hormone's level is increases in women's body, the symptoms like involuntary, irregular or prolonged menses, this type of symptoms are developed there, and which end up with PCOD. So the ovaries develop numerous small collections of fluids, which is called the follicles, and may fail to regulate regulate the release of eggs there. So you can see there in this diagram, with the help of diagram, I like to explain it. This is the normal ovary, and this is the ovary with PCOD. Like a number of means follicles or cysts are there in the ovary. To understand this thing much better, I think we should know some more detail about this thing. So first we can see, you can see on your right side, this is the normal ovary, and this is the ovary with the multiple cysts there. So when we see about the normal ovary, there is a procedure, like a small procedure is there, which is, we should understand this thing to understand the PCOD first. So this is the developmental stage of follicles. First, it develops as primordial follicle here. Then it become a primary follicle, then proceed toward the secondary follicle, and then it matured and called the mature follicle. When it matures fully, the matured follicle ruptured, the egg comes out, and the empty sac is called the corpus luteum. And when this empty sac becomes shrink by their own in few days, it becomes the corpus albicans. So when the mature follicle come out from this egg, this whole process called the ovulation. And when ovulation happens, from here the egg travels toward the uterus through the fibria. And if the favorable condition for pregnancy is there, it helps to develop the child there. If it's not there, it's shed out with as a menstrual flow. Instead of that, this is the normal procedure. Instead of that, what happened in polycystic ovary? There is a developmental problem there. There is a developmental there is a problem in the developmental stage there actually. So the primordial follicle is there, it proceeds toward the primary follicle, and then the development is stopped there. So there is no secondary and mature follicle is there. Instead of that, the multiple immature follicles are there, and all that immature follicles collected there and form the cyst in the ovary. And as all the follicles are immature, there is delaying in the menses, or amenorrhea for few months. It shows the amenorrhea for a few months, or the menses appear in 2 months or 3 months or 1.5 months. It's like that. So I think this is the very important point to understand, that what is the role of this androgen in woman's body, which is an primarily and very essential male hormone. So androgen helps to kickstart the puberty. It have the role to stimulate the hair growth in the private parts, like pubic area or in underarms. It regulates so many organs, although it's necessary for the estrogen synthesis also in adult women, which regulates the sexual desires and the satisfaction, as well shown the key role in the prevention of bone loss also. So nowadays, commonly we'll end up with a very common confusion and a problematic question with everyone, especially sometimes when patients come to us, they come to us by reading so many things about PCOD or PCOS on Google. So they come up with a very common question, what I'm facing nowadays in my practice, that are PCOD or PCOS are same thing, or they have something different? So what do you feel? Is this two terms which are looks very similar? They have some difference in them, or they are very same? So yes, there is a difference in PCOD and PCOS, as PCOS stands for polycystic ovarian disease, and PCOS is the polycystic ovarian syndrome. In this syndrome, there is more than 10 cysts are there, which is more difficult to reverse, which is less common in comparison to PCOD, and can be a major condition there because it can lead to infertility also. Whereas in PCOD, there are less number of cysts, might be 1, 2, or 3, or 4. It's more common nowadays. It's a minor condition, and it's easy to reverse. Even with homeopathy, what I'm experiencing nowadays, with the help of homeopathy, the PCOD conditions even can reverse in 2, 3, or less than, or somehow more than months of treatment. But the PCOD takes some longer time to reverse. Why? I'm explaining that. Because PCOS is an endocrinal problem. There is a metabolic syndrome is there. The metabolic syndrome is a cluster of biochemic and pathological abnormalities with associated with the development of cardiovascular disease as well the type 2 diabetes. And in this condition, it produces a high quantity of male hormones leading to anovulation. That's why so many times the patients, those who are suffering with PCOS, they have a long gap of to menstruation, like 4, 5, 6 months even. And the symptoms also are more severe in PCOS, including the chin hair, which are the most troublesome for girls, the more hard hairs on side blocks, the opacity, infertility, of course, and the hirsutism, where the excess hairs and the blackness of skin, especially at the backside of your neck, is there. Instead of when we talk about the PCOD, it's an hormonal problem. When the hormones are imbalanced, then we'll end up with the PCOD. It contains immature eggs, and then that eventually turns into the cyst there. So the factors which contribute the PCOD is very, very important to understand. Like the first thing is genetics. Females, those who have the same kind of problem in their family, like mother, sister, or grandmother, anyone is suffering with the PCOD or PCOS, they are more prone towards the PCOS or PCOD. They're easily getting this problem, and in very early age even. The inflammation directly stimulates to excess ovarian androgen production and end up with the PCOD. The insulin is a fat storage hormone that concentrates fat in your abdominal region especially, and the higher insulin level can tell the ovaries to make more testosterone there, which is a major hormone in male, actually major sex hormone in male. But when it increase in female, it will end up with the PCOD or PCOS problems. No doubt the healthy lifestyle and the stress. And nowadays what I feel is for the PCOD, the unhealthy lifestyle and the stress and the dietary factor, these are the three main factors what I am observing in my practice. These are the major factors that's why I think the PCOD cases are increasing a lot nowadays. And with the help of homeopathy, I believe we can turn this condition very well. And sometimes it may lead to heavy and painful bleeding. Heavy bleeding, like bleeding for months together, like for a whole month, heavy bleeding is there. Sometimes end up with the cancer also. And the depression and anxiety very commonly present with these patients, because they can't handle that much flow of bleeding throughout the month actually. So this thing, the anxiety especially, is very, very common. So these are some very common symptoms which are present with the PCOD or PCOS. There, that's irregular menses is there, the heavy uterine bleeding is there, weight gain, the sleep apnea, the facial hairs, and the hair fall from the scalp, acne, which are very commonly present, and some more common and severe thing is the mood swing. The mood swing is literally hard for the patient as well as for the homeopaths to handle in the patient during the treatment. But believe me, this mood swing things are very well handled with the help of homeopathy. When patients tell us that the whole things are 360-degree changed now, I mean, they are beautifully come out with this mood swing problem, which are very major problem. What I feel in this case. So, for the better understanding, I think we should go through cases first. So, before going to start the case, I request all the participants to keep very consciously listen about the case, and I like to uh, make this session more interactive. So I request all of you to send your understanding about the case at the end of the case. Before I'm going to show my analysis remedy selection, you can share your rubric selection analysis and whatever remedy is there in your mind after the case. Let's start the case first here. So this is the case of a 21-year-old female, which is she's a student and pursuing her degree there. She is a non-vegetarian, and yes, she consulted to me on 3rd of July 2021, and she come with this USG report to me, and the report shows a small clear cyst in the right ovary, as well multiple small cysts are there, also seen in both the ovaries, measuring 2 to 6 mm. So this is the report. When she consult to me, she come with this report. The complaint what she presented at that time was oligomenorrhea. There is irregular menses since 7 months. Menses appear in 1 or 2 months of gap. There is a spotting for 8 to 10 days after the menses. Sometimes it's very scanty flow and sometimes it's very heavy flow. There's a too much stomach ache. And there is, she feel the heaviness of breast before and during the menses. Another complaints are headache since very long, which is frequent after taking the vaccination for COVID-19. And headache is always better by vomiting. And when she is reading for the long time, she started this headache. She had leg pain, and for that she consulted to someone, and doctor suggested that she might have calcium deficiency. So when I proceed with the case and started talking about the nature of the patient, she started from the sentence like, I like to do creative work like paper craft, the room decoration, the clay work. I love to do that. And I thought I must be or I should be more perfect in that. But I'm not that much perfect in craft and dancing and all. And then she come up with the, in lockdown the routine was completely changed and I doesn't like that. So I asked her what she doesn't like in this change routine. She's like, I feel inactive in that. And she's like, I love to chit chat with friends. So my college is stopped, the coaching is stopped, everything is stopped. There is no scope to meet and chit chat with them because she loved to be with people. She's happy when the people are surrounding, means she is in between the peoples and chit chat with them. So she's like, if routine or my schedule change, I doesn't like that, and it affects her a lot. She's like, my works are delayed, and because of this delaying work is also uh, she doesn't like. She's like, I dislike this thing the most when the work is delayed. She's like, the schedule should be proper. She feel happy when the schedule is exactly proper. Then she'll end up about the relationship of her. She's like, I'm in a 6.5 year long relationship, and still after that much long period, if I get hurt or anger on anything, I'm unable to speak up to him. I'm unable to explain this thing to him that I'm feeling this thing and I'm that much hurted by some particular thing. And whenever she feel low in herself, she's like, I used to cry, and after cry, I feel too much better. And if I improve my routine, that thing also make me feel happy always. She's like, I feel deficient in skill wise in myself. She feel the lacking in herself. And there is always the doubt is there, can I achieve something in my life or not? She's like, I have a lack of confidence when and the fear of competition. When I ask about what competition is, she's like, when I suppose I go to any interview, so many people are there, they are so confident, and all the people are going for the same work. So I was like, I feel a lack of confidence at that time. I doesn't feel that much capability in myself. And this is how she feel the deficient skill wise. She said, I'm sensitive, I'm sensible, and I used to cry very easily. The thing which affect her very badly in her life is the family issues. Either the family issues between the mother or grandmother, or between any cousin or anyway, she is living in a joint family. So any issue of family, any small even issue of family, make her feel so badly affected. Means she is affected very badly with the family issues. She's like, the negativity is developed out of all this thing. I feel very low confident, and I used to cry in alone. She's like, she's very close to his uncle, who expired in the COVID-19, and that was the very unbearable, painful incidents for her. And she's very close to him also. She have a habit of nail biting, and she is a poet also. She used to share his poetry with me always, and she wrote very well all the things. She have an anxiety about mother's health, and that anxiety is on a very high level. She's like, anxiousness about mother's health, it affect me physically and emotionally always. This anxiousness about mother's health make me feel ill always. And she's always tried to do some positive things around her to make her feel happy, because his health, the mother's health, majorly affect on her health. And she's like, whenever she was angry, there is a cold sweat, there is a shivering in body, which is always there. When we see about the family history, the grandfather have asthma, grandmother going through angioplasty, and she have hypertension. Uncle have hypertension and some kidney problem, who is died in COVID, and one paternal aunt also have asthma. Mother is also facing hypothyroidism and some heart problem. Grandmother, the maternal grandmother, had paralysis. Two maternal uncles are there. One also faced with the paralysis. Five aunts are there. Five maternal aunts are there. Two have diabetes, and one is obese, and rest three are okay. If we see the generalities, she gave a very particular generalities here, very important things here, that she desire for sour things, which is for the 4 marks, means the desire is very high for the sour things. And she averts the cooked tomato there, particularly cooked tomato only. Thermally, she is hot. The perspiration order is very, very high order is there. It's a very bad order is there. And perspiration mostly they are on forehead and occiput. And she have a habit of talk during sleep. And she is like, this is my family problem actually. My father is also used to do this thing since his childhood. And the same thing is in me also, and in her brother also. So she's like, that's our family problem actually. So dream, she rarely get dream, and that's also she can't remember any. So this is about the case only. So if we understood the miasmatic wise this case, so this case is predominantly a psychotic miasm case. And why the psychotic miasm? The reasons are pathology itself decide the miasm there instead of the characteristics what we got in the cases. So the cyst is there, the overgrowth is there, which is a psychotic miasm. Other also things are there, that lack of confidence and hurt but can't express the things and all these things, right? So now I request all of you to put your analysis, remedy selection, rubric, whatever you understood about the case. Without hesitation, you can share on the chat box. So meanwhile, I just like to show the before and after report of the patient. As we saw the first report, with that report, she come to me. This is the report: a small clear cyst in the right ovary and the multiple small cysts in both the ovaries, which measures the 2 to 6 mm. Right? And the after report show that there is no significant abnormalities seen in the ovaries, in the both ovaries now here. So this is the after report which we achieved in few months. I'm going to show you everything here, how we going through the follow-ups, the analysis, reportization chart, everything. But before that, I just want everyone to put your analysis there in the chat box, and you have 2 minutes for that, as I know it's going to telecast on the YouTube live, and it takes some some 15-20 seconds late to telecast on YouTube. So we are I'm just waiting for a minute here. Whatever your opinion about the case, you feel free to write in the chat box. I request the moderator, if any comment is there, kindly read for me, because I can't read from the YouTube right now here.
Lyco, Natramure, Medorinum, Natramure.
Dr. Bitu, just repeat once again.
Lycopodium is there. Natramure, Medorinum.
Okay.
Staph agria.
Okay. Anything else?
This much only.
Okay. So I think we should proceed now.
Calcarea carb, califos, proper to dating nails, confidence band of.
Okay, very good. Okay, some answers are very close. Okay, so can I proceed now?
We can proceed now.
Yeah. Okay. So this is my analysis. So what important things we got in this case is there's a change in routine which always aggravate her. There's a lack of confidence. She is a family oriented, because all the things, all the issues related to family is there. She, in the whole case, she talk about the routine, the family things, how the things are affecting her, how the things happens, and the anxiety about family, right? Instead of that, generalities, during an anger, the cold sweat is there. desire for the sour things, aversion from cooked tomato, and the perspiration whose order is very high. So this is about the analysis. When we put all these analytical things in the convert all these things in the rubric, the rubrics come up are mind, work, routine desires, because she doesn't want any change in that. Mind changes aversion to. Mind confidence, want of self. Mind anxiety, aggravation, element from. Mind talks sleep during. Perspiration cold, perspiration odorous. Generalities food and drink, sour acid desires. And the generalities food and drink, cooked food aversion. Because cooked food, specifically tomato, is not there in the repertory, so we can take the cooked food aversion. When we put all these rubrics in repertorization chart, see the medicines with, will come up here. The first position held by the calcarea carb, which covers all the rubrics here. And other very close remedies are there, which I think our audience also suggested, that Lyco, Natamure, the Staph, Calipos, right? So why we'll end up with the calcarea carb only? See, whenever you go with the repertorization, do not prescribe only on the basis because just because the medicine is covering all the rubrics there, or medicine is standing on the first, means medicine come up with the first position in the repertorization chart. Because what repertory is going to show what you, with your understanding of case, whatever you are going to put in the repertory, repertory chart will come up with that understanding only. So always after the repertorization chart, for the final authority and the final prescription, always go through the materia medica there. So when we see the Kali carb in the Soul of the Remedies by Dr. Rajan Sankaran, what's written here is the main theme of Kali carbonicum is the vital fear and reactivity that is seen when a person lacks the support of a family or a group. The main symptom of Kali carb is a fear of being alone and the desire for company. In the Kali carb woman, there is tremendous anxiety and fear when she is alone. She seeks to belong to a group or family so that she is never alone. And anxiety is everywhere there. So another materia medica references, if we go through with the Allen's keynote, great aversion of being alone. Boric materia medica shows the menses early, profuse, or too late, pale and scanty. So why not the other remedies which are almost very close or covering almost all the rubrics there in the repertorization chart, like Lycopodium, arsenic, calcarea carb, ignatia, Merxol, tuja. All these things are, all these remedies are, covering most of the rubrics in the repertory chart. So see, one by one, we are going to, differential diagnosis with the remedies here for the better understanding of materia medica also. So when we talk about the calcarea carb, the main feeling of calcarea is the need for stability and security. Calcium offers protection not only to humans in the form of a bone, but also in the earlier form in the life to form the shell. And this is not the story of our case. She is a family oriented, she need that grouping and all this thing. She need the routinistic work only, she can't bear the change in that. And all these things are the group feature of Kali family. When we come up to rule out the arsenic album here, the arsenic patient sees the world in threatening, in chaotic. If there is no anxiety, no arsenic is there. A very normal rule to rule out the arsenic. Where a great fastidiousness is there. He feels that he is old, weak, defenseless, and there is a thief all around him. And they are ready to take advantage of his weakness. So this is how easily we can rule out with the arsenic. If we talk about the Lycopodium, the main theme of Lycopodium, therefore, is become ambitious, a desire to grow bigger. Lot of efforts which is concentrated fully on become bigger, being more powerful, reaching a high position. And as well, Lycopodium is a coward person. डरपोक होता है बहुत. They can't have courage to do the things. That's why they can't face stage. They can't initiate things in the meetings also. But the thing is, when they, if somehow they start talking in the meeting or start talking on the stage, that initial part is problematic only. Once when they start after some time, they're like the whole stage is their own. Then they got that confidence to talk there. Initially, they are very, because of the cowardness, lack of confidence is there to face the things. Yeah, so this is how I ruled out with the Lycopodium here. Ignatia also covers very well with the rubrics there, but the story of Ignatia is very different. In Ignatia, the problems start with the shock, the grief, the bad news. Ignatia have a great changeable mood, melancholic, very sad, very tearful, always in a tearful mood, always in a melancholic mood. The brooding is there. Thuja also there. As we all know that Thuja is a strongly psychotic remedy. So one of the main theme is the indication is the feeling of fragility. They feel like their legs are made from glasses. That much fragile feeling is there. And they feel like my legs are made up of glass, and they can destroy, or they can break very easily. A feeling of weakness within oneself. This is Thuja. So yes, the prescription was Kalika 1M, single dose, and for the rest 8 weeks, patient was on SL. So what happened in the follow-up? The first follow-up after the 2 months. So she said, I got my menses on 10th of September 2021. The bleeding was proper this time. From the 5th September, spotting was there. And from 18th September, spotting again started, which stopped on 21st September. And the magical thing for her is that there is no stomach pain this time, which is the most bothersome thing for her. There is the characteristic of discharge. So she said, initially the discharge was brownish, and at the end again it changed the color. And she faced some rashes problems also there. So she is like, overall, this month was very peaceful for me. She said, I feel more confident, and the overthinking is not there now. This thing she never, she forgot to share during the case, that she used to do the overthinking on the things. and overthinking is not there, and she started feeling that the solution of her question is there inside her also, even inside her even. So she feel very light, peaceful, and she feel like "Ki, I'm taking responsibility of my mother," as her mother was going through some accident or something. And she's like, I'm not feeling that much tense like before. So this time also the prescription was same with the same potency, the single dose of palicarbonicum and the SL for the next 8 weeks. In the next follow-up, the LMP was 23.8. The periods were very normal. Spotting after 5 days was there. There is no spotting after 5 days bleeding. And yes, the heaviness of breast before and during the menses is there. So again, with the same potency and the same remedy, as the case is progressing very well, I go with the same things. And for the next 4 weeks, the things were same. And this is the follow-up after 6 months. There is no symptom. She did USD on 25th of January 2022, and there is no significant abnormality seen in this USG, as I shown this report before starting the analysis. Yes, I shown already the before and after report. So this is how we solved this case. And now I want all of you to listen this testimonial video of the patient.
हेलो एवरीवन, आई एम विनीता।
His voice is there properly.
मुझे पीसीओडी है और मैंने जो ट्रीटमेंट पहले लिया था, लाइक इट वाज एलोपैथिक ट्रीटमेंट, बट मुझे उसमें ऐसे कुछ रिजल्ट्स लगा नहीं। देन माय कजिन रेफर टू मी अ होम्योपैथिक क्लिनिक विच इज समरागी होम्योपैथिक क्लिनिक, एंड
Dr. Deepu, voice is there properly.
लेट्स गिव इट अ शॉट, क्योंकि लाइक देयर इज नो साइड इफेक्ट्स अबाउट फॉर होम्योपैथी, लाइक इट्स very
Yes,
easy
yes.
for us.
Okay.
So I
Yes.
literally refer to everyone who is suffering from this problem to get an homeopathic treatment for this. Thank you.
Okay, so this was the testimonial video of the case, and this is how we stop or cured this case. So let's see the another case. This is a case of a PCOD of a 22-year-old female. She's also a student. And when she come to me first time on 23rd of October 21, she came with this report, this USG report, and what report says is complex cystic lesions showing multiple thin internal separations measuring approximately 3.0 into 2.7 into 2.5 centimeters is noted in the left adductor, showing no internal vascularities on color Doppler, likely complex right ovarian cyst, and with question mark, the hemorrhagic cyst is there. So let's know more about this case. So the presenting complaint that time was dysmenorrhea and the scanty menses since 2012. So there is a perfect pattern of menses in this case. Like first day there is a normal bleeding, on second day there is a scanty bleeding, on third and fourth days there is a very scanty bleeding, and up to the 7 days the spotting is there only. And backache and stomach ache are unbearable with this case. She's like, since last 2 weeks, there is premenstrual pain is there, started there already. And her last menstrual period date was August 2nd week. And she came to me in October. So before menses, there is a back and stomach ache. Smell of cooked food aggravate her. She doesn't feel to eat that. but she's okay or ameliorate with the fruits. During menses, there is pain, energy level is very low, and lot of irritability is there. She doesn't want to talk to anyone. And after menses, there is no symptoms there. So menarche was started at the age of 14 years. And since menarche, the problem is there in this case. She's like, I desire to eat during menses, but not feel to eat as I see food, there is nausea or something is there. So she's like, I feel to eat, but I can't. There is leukorrhea always before the menses. Initially, the color was white. It's a bland discharge and thick in character. Another complaint is a hair fall. Since last 3 years, the problem is very worse, and the noticeable thinning is there in the scalp. Means when she tie her hairs, we can see the scalp linings there. That much hair fall is there. And hairs are, she explained, like hairs are falling from the root during the oiling and washing it was, and there is no dandruff. About her nature, she explained, like, I'm a silent and an introvert person. I used to hesitate to peoples when, especially when the peoples are new, when I'm with the new persons, and it takes too much time to open with anyone. And she's like, I feel regret and overthinking if things doesn't happen according to me. So she's like, I feel good if things are going according to me only. And if things are not going according to me, I feel like a force or oppression inside me. And she's concerned about her health issues. She feel unfit. And she's like, I can't care much about my things. She explained that she was in a relationship of a 3.5-year-old, and she walked out with some trust issues. And she's like, I come out with very easily with the studies. I come out with this relationship very easily. She doesn't got that much hurt feeling or that much depression or anxiety or something like that. About childhood, she's like, I'm a very obedient child. I was with the studies. I love to do the art and craft work. I have a very small friend circle, and she can't able to do things by their own. She's like, I always need the push of someone else to do my things. Generalities, she desire for pungent things. She's like कि मुझे तीखा ही खाना लगता है. I can't eat that, the food which is not pungent, because that बिना तीखा खाना खाने से मुझे nausea होता है. She feel nauseated if she eat the non-pungent food. As well, milk also. She desire a lot for watermelon and muskmelon, as well golgappas. Thermally, she is more toward the hot, and there is a complaint of indigestion if the slip is not proper, or if she eat in a long distance of gap. And there is always concomitant present with the headache of right sided and nausea. Perspiration are more there on the underarms, that is on the axilla, and at the center of the chest. And she's like, if I wake in between the sleep, I'm unable to get sleep again for a long time. And the meanwhile, when she's not getting sleep for the long time, the next day's planning is going on there in her mind. And she's always planned like, okay, I have to do this thing, that thing, and how can I save time for by doing 2 or 3 things together there. She's like, I can remember my dreams mostly, but I feel like my dreams are in pieces. Like when I prompt more toward these pieces to explain about more, so she's like, no two things are in the sequence, and no two things are related to each other. The dream is like some part of this thing, some part of that thing, but she can't explain exactly what she sees, what is the scenario in the dream. But she's like, the pattern is like this only. If we try to understand the miasmatic concept of this case, just try to understand the case is the psychotic is the predominant miasm, and the case is of a psychosyphilitic miasm. And the reason is that as I told in the first case also, the pathology itself represents somewhere the miasm. So the hemorrhagic cyst is there. It shows the syphilitic miasm there. But there is no any other syphilitic symptoms are present in the case. That's why the dominant miasm is psychotic here. She's introverted, hesitate, overthinking, need push to someone, can't do by herself, take a long time to open up with anyone, to talk with people, especially with the new peoples. So I request all of you now again put your understanding in the chat box. Meanwhile, here is the before and after report of the patient. I hope you can, it's readable for you all. So first report I already read in the initial, which was the 23rd of October's report. And the next report after the treatment is of 18th of Jan 2022. And here, the report of 18 Jan 2022, it shows that USG abdomen showing no remarkable abnormality. Whereas the 23rd October report is complex cystic lesion in left adnex, hemorrhagic ovarian cyst was there. Right? So just I'm waiting for your responses on in the chat box. Dr. Deepu, if any response is there, kindly read for me.
Yes, ma'am. One doctor, Namita says like calcarea curves, and another one is Cilicia.
Cilicia, okay. And
magnet mure.
Okay.
And another was magnesium mure or something like that.
What is that last one?
Last one's is magnesium mure or something like that. I don't know what is that.
I think Magnure.
Magnure.
Yeah. Okay.
Yeah. Dr. Deepa Netmure.
Okay, so can I proceed now? If anyone want to suggest analysis and the rubric selection, feel free to put in the chat box. Okay, so I like to proceed now.
Okay.
So this is my analysis for the case. That aggravation of things are not going according to her. Overthinking is there, dysmenorrhea is there, a smell of cooked food, aggravation before menses, leukorrhea only before menses. headache, indigestion with, and the desire for pungent watermelon, muskmelon, which are there for the 4 marks, and the aversion for milk and thirstlessness. When we convert all these things into rubric, so I'll end up with all these rubrics here. So mind undertakes things opposed to his intention. Mind thinks complain of aggravation, mental and emotional consequences. Female menses painful dysmenorrhea. Female leukorrhea menses before. Stomach thirstlessness, head pain, headache, stomach complaints in. Generalities, food and drink, fruit desire. Generalities, food and drink, spice, highly seasoned food desire. Food and drink, milk products aversion. Female menses before. Generalities, food and drink, cooked food aggravate, sensitive to smell of. So this last two rubrics, the female menses before and the generalities, cooked food aggravation, sensitive to smell of, I break this rubric, means this one symptom into two rubrics here, because we doesn't found that exact rubric of before menses only she's aggravated with the cooked food smell. So we can use like this. We can break that symptom into two different rubrics, right? So when we put all these rubrics in the repertory chart, what we got here, sepia standing on the first position, and so many other remedies which are very well presenting themselves there in the repertory chart. So let's rule one by one all the remedies which are presenting here and suggested by our audience here. So take first we read about the sepia first. So the main feeling of sepia woman is that she is forced to undertake things opposed to her intention, to do what she doesn't want to do. It's a chronic situation in which she has been dominated and not allowed to have her way. Another thing is in sepia, there is a despair, there is no hope in the relationship. You know why she walked out in the relationship very easily? Because since the starting, she is not hopeful about the relationship and all. So instead of that 3.5 year of long distance, means long time of the relationship, she walked out very easily. And she's like, with my studies, I come out with the relationship, this breakup very easily, and doesn't got that much affected. And you know very well in sepia, there is one more thing is there. There's indifference from the loved ones. This is also the main symptom. If we differential diagnose with other remedies which are there in the repertory chart, so sepia come very close to the natremure. So someone suggested the natremure. So why not natremure? Because both have the theme of disappointment in love, right? The theme of the body being disfigured. But the dependency of natremure is much greater. The main problem of natremure is not between relationship and occupation like sepia. It is between the making and breaking the relationship. So what natrum, instead of, if she is not sepia, if she suppose she's natremure, what she used to do, not even that 3-year-old relationship, if the relationship was there for 3 months now, rest 30 years she will waste. Natremure can waste for that 3 months of incidents. That much emotional dependency there in the natremure, and that's too with the one person only. Natremure have that one-to-one relationship. They can overwhelm all their emotion to the one person only, and they can't expect, or they can't have that feelings to share with the other, because they you know they overwhelm and overly expect and overly love with the one, and from that place if they feel the cheated or breakup is there, they can't it means they are unable to form that kind of emotion again in the life. So that's natremure, and which is not the scenario of this case. So there is no contradiction of will in natremure. The whole theme of one of relationship and not two separate theme, occupation and relationship, like there in the sepia. So sepia is the large sphere of which natremure is a part of it. That's why we doesn't select the natremure for this case. The naxomica, the acute of sepia is naxomica. So the naxomica is concerned with occupation and business with tremendous irritability and has many symptoms similar to sepia, example, constipation, etc. In an acute situation of business failure, the sepia person can need naxomica because that's acute. Suddenly something come up, na? So in sepia person, when the sudden crash is there, the naxomica is the remedy for that time. Another one is the lachesis. Sepia comes very close to the lachesis with its envy and dream of snakes. But in lachesis, the emphasis is more on keeping her attractive. You know, lachesis always have focus on the looks first. Is there is a competition and she has to win it. And if they can't win, there is a feeling of jealousy. Right? Sulfur is also there in the repertoire chart, very well covered all the rubrics. So the main feeling of sulfur is that of being scorned, suppressed, put down, criticized. The person is made to feel humiliated. His pride is hurt. Embarrassment is one of the main feeling of the sulfur. Phosphorus, the main feeling of phosphorus of being unloved and uncared for, to which the patient react of being affectionate, you know. And the phosphorus people are easily mixed up with all the peoples, you know. They love to show their affections toward the people because same affection they need in for themselves. So there is a rubric also, affectionate returns affection. They are affectionate because they need that. They are behaving with people exactly the same way what they want in their life, where they feel lack in their life. Right? So phosphorus is ruled out here. When we thought about the pulsatilla, the remedy belonging to the psychotic miasm, no doubt, the main feeling of pulsatilla is that of softness. It is like the wind flower, you know, yielding disposition. जिसने इसने क्या बोला हाँ, इसने कुछ बोला तो भी हाँ. Wind flower which must bend to every gust of wind in the order to survive. Pulsatilla feels like if I'm not soft, if I'm not molding with the waves, I can't survive. I will survive if I'm soft and gentle and not hard and rigid. This is the feeling of Pulsatilla. That's why they are so much yielding. Yeah, so other suggestion was there by the audience, like magnesium moor. So see, magnesium have a theme of orphanage feeling, you know. Instead of being with family, instead of being with friends, with society, they feel so much you know, alone in their life. That orphanage feeling is there, that much aloneness, that much deep that feeling is there, that they feel the orphanage. So Magnesia group of remedies are famous to known as orphanage remedy. So for this case, the prescription was sepia 200 single dose, and for the rest 4 weeks SL was there. After for 1 month follow, the menses flow was good this time. The last menstrual period date was 26/10/21, and the same day was means the day of follow up is her 5th day. So she is like, there is no mood swing this time, at least. The pain is much better. I'm not feeling that much tired, and there is no leukorrhea. Vertigo is not there. Not feeling that much exhausted. Hair fall is somehow better. Appetite is good, as this time eat during menses also, like she always want to eat during menses, but she was unable. This time she ate normally. Sleep is better. Before the overthinking was there during sleep, and the mind is not relaxed before sleep, so now it's not there. As dream, she can't remember well, but some dream somehow she expressed this time, like a friend is died and her mother is emotional and upset. I'm also upset there. In a building, a kid was hanging. This kind, right? And the fearful dream for this is the fearful dream for her. So this time I prescribed Cipia 1 m there in the single dose. Why 1 m this time in this case? Because we should keep in mind the pathology also always during the prescription, and for the selection of potency also. It's a hemorrhagic cyst is there, and which is progressive. So that's why I shifted this patient from 200 to 1 m, although the case is going well. When she is come with the very positive result of us, the symptoms wise, she is feeling very better. So the next follow up after 3 months, she feels good, everything is normal. The hair fall is there, but she is like, hair fall is there, but the regrowth is good now. Regrowth of hair is good now. The last menstrual date was 4th or 5th of December. And spotting was there on 5th of Jan. And she's like, this time the flow is normal. Stomach pain, back pain was there for 2 days. And this time I shifted her on 0/7, the LM potency, LM7 potency. Again, the reason is same, what I explained right now. After 4 month follow-up, there is no any other complaint. The hair fall is better, but not completely stopped. But not any other significant complaint of period was there, and the LMP was 7/1/2022. So I shown already the before and after report of this case. So this is how this case is closed here. And this is the testimonial video of the patient. Hope you all inspire and get too much energetic after listening her.
मैं अंशु हूँ। मुझे पहले पीसीओएस का इशू था और फिर मैंने होम्योपैथिक ट्रीटमेंट स्टार्ट किया। मैं अगस्त से ट्रीटमेंट ले रही हूँ एंड नाउ सब चीज़ें नॉर्मल हैं। पहले मुझे पीरियड्स बहुत टाइम इंटरवल्स में आ रहे थे, फिर मेडिसिन लेने के बाद वो टाइम इंटरवल कम हुआ। पहले जैसे मुझे क्रैम्प्स वगैरह होते थे, स्टमक एक होता था, वो सब चीज़ें अब नॉर्मल हो गई। मूड स्विंग्स बहुत होते थे, वो भी अभी कम हो चुका है और बहुत ज़्यादा इफेक्टिवली इसका अच्छा इफेक्ट रहा है, इम्पैक्ट अच्छा है। और मैम ने बहुत अच्छा ट्रीटमेंट दिया, गाइडेंस अच्छी दी। और मैंने विभा मैम से ट्रीटमेंट लिया है समराइजिंग होम्योपैथिक क्लिनिक। तो
So you are happy with your treatment now?
या
Okay. And what's your age, Anshu?
22.
Okay, Anshu. Thank you. Okay, so this was the second case of today. Let's see some other things instead of this thing. So the complications of PCOD. So the major complications of PCOD is the infertility, first thing. Second is the gestational diabetes and hypertension. The depression, anxiety, the eating disorder, abnormal uterine bleeding, which is worst to experience in the girls. And the obesity is associated with PCOD and can worsen complaints of the disorder. Other thing is how to diagnose, how to land up with, if you got any direct patient to which doesn't have any previous reports with them. So with these symptoms, instead of other things, I think you should directly go for the USG abdomen only, which is the best thing in the to diagnose the thing. Diet. In PCOD cases, diet is very essential to understand that you should always advise the avoidable and edible diet for the PCOD patient, and they should follow this thing. They should avoid the sugary diet, the processed meats, the refined carbohydrates like pav, white bread, pasta, pastries, cakes, ice creams, the fried foods. They should avoid all these things. And what they should add in their diet: legumes, green leafy vegetables, nuts, berries, spices like turmeric and cinnamon, which helps to improve the problem. So this is all about today's presentation on PCOD. Before going to proceed for the question and answer session, I like to inform all of you that Samragri Institute of Homeopathic Education offering 3 courses, that is the certificate course in classical homeopathy, basics of classical homeopathy, and a short-term course in classical homeopathy. So you can join it anytime and get benefit and learn the actual concepts of classical homeopathy. So this is about the CCCH course, that is the certificate course in classical homeopathy. The duration of course is 3 months, 4 days in a week. It's an online course, so you can join from anywhere. The eligibility is UG, PG practitioner. Anyone can join the course. The second course is of basics of classical homeopathy. The duration of the course is a 1 month. Again, the mode is online, so you can join from your home. Eligibility is same for all the courses. Third one is the short-term course in classical homeopathy, that is STC. It's a 2-week course. The mode is online, and again eligibility is same. So you can apply for the course. For more detail or any doubt, you can contact on the number given below the below your screen, that is 9111005009, or you can write to us on the given mail ID also for the inquiry of courses, or if you want to know more about course. So this is the highlights of our 3-month course, that is the certificate course in classical homeopathy. You can get clear your concepts of homeopathy, understanding and gist of remedies, case taking in very detail in all kinds of things, case taking, the practical application of organon, how to convert the patient's language into rubric, the repertorization using different repertories, selection of the right potency and the pathological prescription, and many more things we are offering with our 3-month course here. So you can apply and apply anytime. The number is same, the 9111005009. Samragri Homeopathic Clinic is always ready with the online consultations for all the patients, and you will get medicines on your doorstep. We are running also the online and offline yoga classes also under the Samragri Yoga Studio. You can experience all this thing with us. You can follow us on Facebook, Instagram, YouTube, everywhere by the same name of Samragri Homeopathic Clinic. And for more detail, you can go through with our website, that is www.samragrihomeopathicclinic.com. So now I request, if anyone have any question regarding the session, kindly put your question in the chat box, and Dr. Deepu, it's better if you read questions for me. Thank you.
Yeah, yes, ma'am. We have one question from
Yeah.
Dr. Deepa.
Mhm.
Can we treat that the dermoid ovarian cyst?
Sorry, I didn't got your question. Kindly read properly.
Okay. Can we treat that dermoid ovarian cyst?
Dermoid ovarian cyst.
Yes, yes.
Okay. Yeah. We can do, but before taking the case, I need the report of course. How much the things are old, how much the disease is progressive, but definitely we can work on this.
Okay.
Any doubt for cases?
No, ma'am.
Okay. Any other question is there?
No, there is no any other question till now.
Okay, so we are waiting for 2 or 5 minutes because it's telecasting late on YouTube. So meanwhile, if anyone have any doubt for courses also, you can ask us, and they can write to us also. The contact detail is there on your screen.
Yes, ma'am. One question is coming from Dr.
Yeah.
Banerjee.
Yeah.
He says, ma'am, can you explain mind undertakes things opposite to his intention? Rubik selection in last cases.
Yeah. So the second case, the sepia case, mind undertake things under to his intention. The meaning of the rubric is like what the first sentence in the case patient explain about herself, that she is not comfortable when things are not going according to her, and if she want to do, or she is forcefully she have to do something which is the most uncomfortable thing for her. So for this sentence or for this symptom of patient, the rubric, when we convert in the rubric, this is the rubric for that. Yeah. Anything else?
No, ma'am.
And this is the very you can say the very highlight rubric for the sepia. This rubric, I think, represents the sepia's mind actually. Okay, anything else?
No.
Any question on Zoom? If someone is there to read from Zoom. Okay, some questions are there in this Zoom actually.
Yeah, this ma'am. One question is come from Dr. Deepa. How the potency selection?
How the potency selection? Okay, the potency selection depends on the patient's level as well on the pathology as well. You know, patient's level means patient talking on which level. Like it's very superficial to talk, like patient is unable to explain even the even the modalities of the case. A patient just come up with the name of the disease, or patient is explaining the things a little bit better, or patient is too much good to explain the mental symptoms of his very well. So on this, the level of experience of the patient is the base to select the potency for me, as well the pathology also. Doctor, can you read questions from Zoom also? There is a question by Dr. Rekha, I think. Time taken for NML USG report. Dr. Rekha, please rewrite your question. Okay, so many responses are there in between cases. Responses are also there in the Zoom. So talk and slip during when understand easy. Okay, so Dr. Mayandar Sahu, he said that talk, slip during, cannot understand, ease, clarify. I think you didn't understood the rubric why I took this, because there is a symptom what patient explained that she used to talk during sleep. That's why I took this thing. Okay, there is a question by Dr. Bindu Chawla that is it not spicy instead of pungent? No, spicy and pungent things are different. If in Hindi we are going to differentiate this thing, spicy is masaledar and pungent is tikha. So she likes tikha and not the spicy. So there is a difference in pungent and spicy things.
Okay, ma'am. Another case is question is coming.
Yeah.
Please explain higher potency when treating for syphilitic miasmatic state in case 2.
Okay, so in case 2, I put patient on 0/7 at the end, like LM7 potency. See, when the pathology is high, definitely we put patient on the on LM potency, because with the higher potency, we can't repeat that much, that 1M or 10M, we can't frequently repeat there. But LM potency is very safe to repeat, the repetition of dose is very safe with the LM potency. So at the end I put on that case on LM7 on daily basis, OD on daily basis, right? So with the pathology also, yeah, definitely the pathology was the syphilitic. That's I put on the 0/7 potency.
Okay, and then another question. Yeah, another question is came that after given 200 potency, or why we give LM potency?
After 200, 1M was there, and after 1M, I shifted the patient on LM potency, because I need to increase the potency according to the pathology there. That's why. Any other question?
No, none, ma'am.
Okay, some query is there about the recording, so please contact Dr. Deepu for that. Okay, any other if you have any other query, you can write to me on our mail ID or WhatsApp us anytime. We will definitely try to solve your queries there also. So thank you so much all of you for your patience fully attending this session. Thank you so much IHMA, Dr. Deepu, for inviting me and giving this platform to experience my experience. Thank you so much all of you, and I think we should
Vibha,
conclude.
just a moment.
Yeah.
Dr. Sini.
Now I invite Dr. Namita to deliver vote of thanks.
Thank you, Vibha Mehta ma'am, for a wonderful and informative session about PCOD. The cases you presented was very clear and good, and the differential diagnosis of medicines was very useful. Thank you, ma'am. Now, I thank each one of you who attend the session and also give sincere gratitude for the persons behind the screen for their work to make this seminar a success. Once again, thank you all.
Thank you so much.
Yeah, candidates, please note, our next webinar will be on March 2nd at 8 p.m. on the topic Homeopathic Management of Headache by Dr. Minal Suhani. So I expect all of you to present in